I don't know what the difference between the right and the left side would be, other than if you're talking about the organs of the viscera, like the organs inside of your torso, essentially sort of sagging to one side or the other. Maybe if you sag to the right, it would stretch a nerve that is associated with stress. I'm totally making that up. I don't know. But the position to avoid is, ironically, on your back for most people. So I shouldn't say most people. So for people who have sleep apnea, or for people who are overweight, because if you're overweight, you're more likely to have sleep apnea. So when you lay on your back, you have what we call the oral pharyngeal. So like the air passage behind my nose and behind my throat goes down, obviously, into my lungs. And there's soft tissue there. And the tension of that soft tissue matters, which is where hormones come in. We'll skip over that. But if you lie on your back, then that tissue falls backwards. And if it falls backwards enough, then it covers your breathing. And so then you have to pull really hard. You have to breathe deeper. And that actually pulls you out of certain phases of sleep, because your diaphragm is what we call smooth muscle. And it pulls with a certain tension. But if you want to go past that, we start using accessory muscles. We start using skeletal muscles, which are paralyzed during REM sleep. So if these muscles should be paralyzed, and you're having to breathe past that, you're having to use these accessory muscles to get past that. That's what snoring is. So everything collapses and it pops like this, and that's what the snoring sound is. So if you lay on your back and you have sort of a thick neck and you have maybe a short oropharyngeal pathway, maybe you're overweight and you have like a lot of fat in your neck, and that all just like weighs down on that, and it presses down on it, and that causes snoring, and then snoring leads to what we call desaturation. So your oxygen, your red blood cells carry less oxygen, which is detrimental to your health for lots of reasons. So if you're a heavy snorer, I would say stay off your back. If you are not a snorer, ironically, being on your back is probably best, because orthopedically, that's the soundest way. If you think about if this were my spine and you're looking at me from the side, my spine has these 4 curves in them, and those curves, when I'm standing up, like give me this spring load when I'm laying down this way. If those 4 curves can be maintained and my position, my airway passage isn't compromised, then my spine is only bending this way with the motion of the mattress, right? And whether my head's high on a pillow or low on a pillow, or sinking down into the mattress because it's a soft mattress or whatever. So that's the way my spine's meant to really curve the best. When I lay on my side, it's not as mobile. So if you have orthopedic pain, so hip pain, shoulder pain, low back pain, laying on your back is probably the most comfortable way to go. If you find that laying on your back leads to snoring, and especially if that snoring gets really loud and it leads to skip breathing, so you'll hear someone snore, it pauses for 20, 30, 45 seconds, and a super big gasp, and then they snore again. And this is usually men, and it's usually the only way they know it happened is because their wife told them that you stop breathing in the middle of the night, I think you're dying. Because the men fall asleep really quickly and the women lay there and they're trying to get all the stuff out of their head, and the men start their snoring, and then the skip breathing, and it concerns women, and they tell their husbands to go get a sleep study, and they do, and a whole series of mess with that. So if you are a man and you snore, well, I don't care if you're a man or a woman and you snore, go buy yourself a Hanes t-shirt that has the pocket right here, and you cut that pocket off, and then you re-sew that pocket right between the shoulder blades back here of that t-shirt. And it should be a fairly tight t-shirt. So if you're my size, you want like an extra medium. If you're like a large guy, you want a small. If you're a medium guy, you want an extra small. It's a pretty tight t-shirt. And you put that pocket right between your shoulder blades. And then you put a tennis ball in there and you sew it all in there. And then you won't lay on your back because it's uncomfortable. And so you'll lay on your sides. Now, if you have a really soft mattress and you have some orthopedic injuries or inflammation, and this could be metabolic, this could be physiologic, this could be from past injuries. There's lots of reasons you could have joint pain. But if you start sagging your spine sideways like that, then that causes a lot of pressure. It causes stretches on nerves from one side to the other. Again, maybe that's what the chiropractors are talking about. They know more about the nerve balance associated with the spine than I do. But if you lay on your side and you stretch the nerves out, that causes pain. When you cause pain, that causes you to shift. Every time you shift, whether it's because you're too hot, because the blood flow is decreased, because there's too much pressure where you're laying, or because you're in pain, every time you shift, it takes you out of deep sleep and puts you back into stage 2, or it takes you out of REM sleep and puts you back into stage 2. And then you have to fall back asleep and get back into REM or get back into deep sleep. So that's interfering with your sleep architecture over the night. So the ideal position is actually what we call the semi-prone or the half army crawl. So it's like you're halfway on your side, you're halfway on your belly. So you like have a little shift in your hips and like one knee is kind of bent up, and like that's the least amount of pressure on your spine if you have the right pillow height. But I would just say if you snore loudly, stay off your back. If you know that you have a lot of joint pain, you really have to focus on making sure that you have the right mattress, so that you aren't, the most common problem is that the mattress is sagging. And if the mattress is old, and if you get one of these new foam mattresses, these mail order things, those things last like 2 years. And then they start breaking down and you really start sagging. And then that's going to cause pressure. It's going to cause nerve pressure. It's like going to be stretching nerves and it's going to be compressing on joints. And so at that point, you want to get a new mattress. Just buy a good bed. I mean, you only have to waste money on 2 things: a really good bed and really good shoes. Because if you're not one, you're in the other.